بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. It is my pleasure to be with you today, inshallah, in the first International Annual Conference of Medical Education Unit of the Faculty of Medicine, Girls, Al-Azhar University. Actually, I'd like to thank the organizing committee of this important conference to invite me to be among with those distinguished chairpersons and speakers in these important topics and session about clinical competence for medical internship. My talk will be about workplace-based assessment as the straightforward way for competent interns in the new curriculum 5+2. I hope my talk will fit the purpose of this session, and the purpose of this conference is this crucial era in the change or the paradigm change in medical education in Egypt. Let us start by my outcomes to identify the different types of assessment based on Miller pyramid, which will be my introduction, followed by description of the educational principles that underpin workplace-based assessment, which answers the questions why, and followed by discussion of the key issues in the implementation of workplace-based assessment, or how. The last but not least is related to recognize different strategies of workplace-based assessment, or what are the strategies to be used and what are the steps to be followed to implement workplace-based assessment in internship. I'll start my introduction by the learning cycle, which is important for any types of assessment, not only workplace-based assessment. It starts by identifying the learning outcomes, followed by planning for learning, which include different teaching and learning strategies, and the final step is related to feedback and assessment, or our today's speak about workplace-based assessment, which includes the assessment and giving constructive feedback. I think all of you are familiar with Miller pyramids for assessing clinical competence, which have 4 levels, starting by knows how, shows how, and does. Also, it includes the professional authenticity, start from a novice learner to until becoming an expert learner. Today we are speaking about the does level, or the highest level of Miller, which is in the workplace and need workplace-based assessment for evaluating the competencies of the trainee or the learner. What is workplace-based assessment? Workplace-based assessment are the tools and the process used in the collection of data about the trainee performance in the workplace and the judgment of their competencies by an assessor, let us say trained assessor, for a range of summative or formative purpose. In a simple way, it includes multiple observation by a trainee, trainer, followed by a verbal feedback, which needs a quality documentation, for example, e-portfolio. This figure summarizes this process. Start by multiple observation, constructive feedback, which needs self-reflection from the learner or the trainee or the student. Need documentation, let us throw e-portfolio. And what is here in this background? It is a competencies, and this figure shows the CAMMED competencies, which is one of the most famous framework for clinical competence in Canada. But what is competency? Competency is an observable ability of a health professional integrating multiple components such as knowledge, skills, and attitude. Since competencies are observable, so it can be measured, assessed to ensure their acquisition. So it needs a tool to be assessed. So this is competence, which is a combination of knowledge, skills, and attitude. Okay, We have more than one framework for competencies. One of the famous one is the CAM-MED, which the doctor or the physician as a medical expert should be professional, communicator, collaborator, leader, health advocate, and scholar. In Egypt, we have that of NARS 2017, which consists of 7 competence areas as a healthcare provider, health promoter, professional, scholar, and scientist, a member of health team, and a part of the healthcare system, and a lifelong learner and researcher. In Saudi Arabia, we have the Saudi Med, which puts the patient in the center of the competency framework, and the learner or the graduate should have a scientific approach to practice, patient care, research and scholarship, professionalism, communication and collaboration, community-oriented practice. What is observed in these 3 framework? Similarity, more or less, or even just a change in the word and terminology, but by the end, we need a competent graduate or a competent GB, general practitioner. We have a previous session with Dr. Jihan, Prof. Jihan, about interruptible professional activity, which is a unit of professional practice defined as a task or responsibility that trainee are entrusted, and the keyword here is entrustment or entrusted, to perform unsupervised once they have trained sufficient specific competence. For example, gather a history and perform a physical examination. So in EBA, we need more than 1 competencies to form the EBA or the interruptible professional activity. And mashallah, Dr. Jahan covered this topic in details, but we need it here because in workplace-based assessment, we need to select certain EBA to be assessed by workplace-based assessment. This is an example of how competencies are integrated to form EBA, for example, in certain postgraduate clinical residency program. So this was the introduction of this session. Let us go to the golden circle. We have 3 terms: why, how, and the what. And for the workplace-based assessment, we need to ask ourselves why we do it and how we do it, and finally what we do in relation to workplace-based assessment. My questions here: by which you will start? By why or how or what? From internal to external, from inside to outside, or from outside to inside? Actually, we need to start by why, then how, then what. It's because if you don't know why you will implement workplace-based assessment, we didn't know how and what. So let us, in any work, start by why followed by how and what. And actually, you have some balloons. Not only why and how and what, we have also when and where and who, which may need another session to complete all balloons of these questions. Okay, so now we will describe the educational principles that underpin workplace-based assessment to answer the questions why. Again, start by Miller pyramid. Why? Because workplace-based assessment will assess the highest level of Miller pyramids, which means that we are approaching the professional authenticity or our graduate or student will be experts. So, workplace-based assessment conform to the highest level of Miller pyramids. It focuses on clinical skill, including the necessity of soft skill, communication, behavior, professionalism, ethics, and attitude. It depends on observational in real situation in workplace. So it is the highest, it is authentic. It is also means that it is context and content specificity, which increase the validity of this tool. Workplace-based assessment include constructive feedback and also encourage reflective practice. The last but not least, it is alignment of assessment with actual working. And do you remember this this golden triangle about the alignment between assessment, objective, and assessment. Workplace-based assessment or any tools of assessment is based mainly on entrustment. As we mentioned before, the entrusted professional activity, you need to your graduate to be entrusted. You leave him alone and with the patient, and you are sure that the patient will be safe. The same when you will give your son or daughter the key of the car. Only when he or she is interested that he will drive safe and will not hurt himself or herself or others on driving. So workplace-based assessment is all about entrustment. So we need EBA in applying or implementing workplace-based assessment. Let us go to how the key issues in the implementation of workplace-based assessment. And on how we need to remember the constructive alignment, as we just mentioned, between learning outcomes, content, and the assessment. So this alignment is important in implementing the learning, the workplace-based assessment. Also, we can simplify and expand this figure by starting by the purpose of assessment to assess the highest level of Miller pyramid does. You need to revise the intended learning outcomes of the internship or the rotation in which students will be assessed. Develop a test blueprint for this assessment in this internship rotation. Need to item development, which is related to different strategies of workplace-based assessment. Test administration in the workplace, in the hospital. We need the quality or item analysis, whatever the process of item analysis, or to ensure the quality of assessment. So this is one of the part of that. But remember on how that the trainee or the student should be safer. Safer, the S, which refer to spread assessment through rotation, internship. A, as many assessors as possible. F, feedback as well as scores and reflection. E, evidence it all, follow up by action. And you need here the portfolio or the logbook to document all what is related to workplace-based assessment. And finally, reflect on what they do. Let us use the reflective journal to learn, to teach the student how to reflect on their own experience on workplace-based assessment. And we need to remember the utility function or utility formula about assessment. Any type of assessment, including the workplace-based assessment. R, reliability. V, validity. A, educational impact. A, acceptability. C, cost. And the W is the weight. And remember that it is not a mathematical formula, but unfortunately, if any of its element is zero, the assessment failed. So if the reliability is questionable in the assessment, so the utility function will be zero. So we need to focus on workplace-based assessment on all these elements to ensure high quality assessment and valid, reliable with educational impact, acceptable and cost. This is the definition of each elements of the utility function or utility formula. I like this slide because it collects all the information about these elements in a very brief manner. You can, if you want, you can photo it. Okay. The last part of this session is about what. And then what, we have two questions. What are the strategies for workplace-based assessment, and what are the steps to be suggested or followed in implementing workplace-based assessment for internship? For what do we teach and assess in clinical setting? We teach and assess clinical knowledge and skills, procedural skills, professional behavior, interpersonal skills, and judgment. For clinical knowledge and skills, we have a case-based discussion, which is one of the tools of workplace-based assessment. For the procedural skills, we have a direct observation of procedures or DOPS. For professional behavior, we have direct observation of non-cognitive skills or non-clinical skills. For the interpersonal skills and judgment, it is the most difficult, and it needs a multi-session of assessment, so it needs a 360 appraisal feedback from different stakeholders, from students, from other trainee, from other trainers, from nurses, from physicians, from technicians. It needs a lot of work to be implemented. So this is some example of strategies of workplace-based assessment. Each one needs a separate or a specific or special workshop to be for training on implementing them. Just the most important example of workplace-based assessment, the mini clinical exam or mini CX, which assess the following competence: communication with patient, physical examination, diagnosis, treatment plan. Assessor here could be educational clinical supervisor or senior trainee setting in the workplace for in the clinical world and community. For the case-based discussion, the competencies are clinical judgment, clinical management, reflective practice. Assessor the same, educational clinical supervisor, senior or trainee. Setting in multiple area covered by a challenging case because it is done through the patient notes mainly. DOPS or direct observation of procedure skills. It covers the technical skills, procedures, and protocol, and also, by the way, some clinical or some communication and history taking. Here, educational clinical supervisor, senior trainee, multi-professional team, and it could be done in clinic or ward or theater. For terminology, case-based discussion, we have also consultation observation tools, mini clinical exam, DOPS or direct observation of procedure skills, multi-source feedback or MSF, patient satisfaction questionnaires or PSQ. All evidence need a portfolio for each GP trainee or for each intern trainee, inshallah. Okay, the last part of this talk is about my suggestions for the action plan for implementing workplace-based assessment or the steps to be followed in the process of its implementation. Let us start by formulation of committees for workplace-based assessment at different levels, at department level, at college, and even at ministry level, especially the Ministry of Health. You need to select the EBAs to be assessed by workplace-based assessment or the interestable professional activities to be included in the internship rotation. You need to start to awareness campaigns on workplace-based assessment for both faculty members and students. Also, we need to train faculty member and student on the implementation of workplace-based assessment. Prepare the forms which will be used for scoring workplace-based assessment. And in this point, you can use a ready-made form, especially what is in EMI guide, I think number 31 for Norsini, which could be a good guideline for workplace-based assessment. Then following an important point, which is related to the arrangement with partner hospitals, especially in Ministry of Health, to train their preceptors, especially we have a large number of interns who are trained in Ministry of Health hospitals. Then you need to decide on the tools to collect evidence on student performance, for example, electronic portfolio or logbox. The last but not least is to develop tools for evaluating the effectiveness of workplace-based assessment, including stakeholders' perceptions, like questionnaires for all stakeholders. Take-home message. Workplace-based assessment is related to the highest level of pyramid, the DAS level, which is in workplace. And also we need to remember that Miller has its modified form, which include another level above DAS, which is the S, which is related to identity, which related to professionalism and attitude, that need another type of assessment, which more comprehensive, like the multi-source feedback or the 360 exam. And again, workplace-based assessment is mainly about entrustment. Your student or trainee will be entrusted to do certain competence or to do certain maneuver or certain EBAs without supervision. So Alhamdulillah, we finalize this session on the time, I hope, covering these outcomes and by our introduction and why, how, and what questions. I hope I answered all questions, and this is just an introduction to workplace-based assessment, but I think there is a lot of steps which need to be followed to implement workplace-based assessment with our high expectation in it in our new curriculum. This is my gift to all of you. This is the barcode for my YouTube channel. Please scan it. Actually, my YouTube channel contains 10 videos on workplace-based assessment. All of them are short videos, but actually they cover everything related to workplace-based assessment. I hope all of you will benefit from them, and please, if you get benefits, share the code with the barcode with all of our colleagues who are interested in workplace-based assessment. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.